Hello everyone, and welcome to this audio podcast. This audio podcast as part of a Cortex Narrate series. This audio podcast is part of a Cyclone Cascade, and this audio podcast as part of a Coachella Blitz, and this audio podcast as part of a Storm Robotics production. So now looking into delving into some further aspects around the contentions around calculating CKD. So, estimated glomerular filtration rate, or EGFR, is calculated from serum creatinine using or historically utilizing age, gender, and ethnicity of recipients, and a methodology identified as as an MDRD. One of the equation examines one of the equations or calculations examined previously supports the utilization of MDRD and the EGFR to provide more consistency. And this is particularly useful or has been helpful in recipients who have milder CKD dysfunction with an EGFR of in around between 45 to 60 mil per min. Many CKD recipients with EGFR more than 60 mil per min have suffered miscalculation, and this has resulted in the introduction of the calculation of another calculation referred to as the chronic kidney disease epidemiology collaboration, or CKD-EPI. And this is based on a collective research in a clinical population that has reduced the problems or issues around the use of EGFR measurement, or EGFR use in solo, making it useful more than the MDRD calculation. However, only a few studies or investigations have highlighted the delayed in recognizing the symptomologies of CKD, which are often missed in primary care, resulting in a delay referral to secondary care. One team or investigation has noted had noted that effective GFR monitoring can keep negative physiological and pathological states at bay, and other investigators believe that the main use of EGFR has been to detect early signs of CKD to avoid further renal injury, or factors related to other primary comorbidities. The MDRD has been the most extensively utilized calculation or equation to determine EGFR based on several variables. However, prevalence rises with age, and is found to be more common in females than in males. The epidemiological importance of ethnicity has not been completely articulated. However, more recent literature, there has been works looking at a creatinine, the creatinine or serum creatinine equation, and the biomarker based equation, where it could potentially be compared with the use of the a cystatin C based equation, where cystatin C is another biomarker. However, findings require further validation in and across groups of patients, and for example, and so and so at the same time, the measure the MDR the epidemiological importance of ethnicity has not been completely articulated, although works has been investigated in some ethnic minority populations, and compared between, for example, in amongst the United Kingdom and amongst United States populations. The measurement of EGFR is more commonly used or utilized in clinical laboratories to measure serum creatinine in line with the MDRD. However, A systematic review to facilitate CKD epi has resulted in more accurate calculations and showed the risk of renal failure and mortality was lower than in those studied studied with MDRD sort of calculation. And according to research, sort of other research, CKD epi has been a more proficient equation than the MDRD to calculate EGFR, although more recent guidelines have provided sort of measurements and replaces the formula. Many suspect or high risk individuals are not classed among CKD stages 1 through 5. At the same time, the abnormalities associated with CKD are revealed either by additionally either by scanning or radiological procedures that identify conditions such as polycystic kidney disease or reflux neuropathy, or through a biopsy in cases of glomerulonephritis. Now, at the same time, or new EGFR equations or calculations that incorporate creatinine and cystatin C, for example, but omit race are more accurate and tend to have led to similar differences in renal function between ethnic minority populations, i.e., those amongst for example amongst those from BAME, Black, Asian, and minority ethnicities, and non-Black, Asian, and minority ethnicity participants than, for example, where new equations where creatinine or cystatin C biomarkers alone are implemented from a laboratory medicine and pathology perspective. That draws this audio podcast to a close. This has been an audio podcast as part of a Cortex Narrate series, an audio podcast as part of a Cyclone Cascade, an audio podcast as part of a Coachella Blitz, an audio podcast as part of a Storm Robotics production.